I wanted to make this video because just gotten some notice from other channels that I subscribe to that the VA is trying to backdoor several rating schedules to only uh, they won't they won't change our our medical benefits, but they're going for our pocketbook. They will change several different rating schedules for various bodies. It's a group or cluster of medical issues, generally related by organ system or skeletal system or hormonal system, etc., or respiratory or cardiovascular, etc., or mental disorders. Um, but they will change the comp and the pension based on the treated symptomatic changes. So they're backdooring the same exact thing that they were going to do 6 months ago. You know, I don't know your party, but what I'm finding the past 10 years, Republicans screw over veterans left and right. Now, when the election year is coming, next year it begins, campaigning, they want to look good, so they try to make it look like they genuinely care about our catastrophic veteran brethren. Someone who lost a limb, someone who became paralyzed, somebody who received concussive injuries, et cetera, et cetera. More catastrophic. They've suffered a lot. Their families have suffered a lot. So Republicans want to look good. But when you step back, you see that the changes they do are myopic. They don't increase lifetime earning capacity, even for our brethren who have catastrophic injuries. They don't increase their lifetime income capacity. There's very little change, and their families are lucky if they recoup, the expenses that the entire family has had to endure, to get their veteran, up and just feeling better. Um, Maybe not able to do what they used to do, but so they feel better about their situation and they feel a little more empowered to fight more, to fight, and take back as much of their life as they can for the situation they're now in. But the Republicans are not increasing that veteran, their ability to earn more, and neither are they for non-catastrophic veterans. They are screwing us over. They're doing the same thing, like I said, that might not even be 6 months or maybe 3 months ago, that they were proposing to do, compensating us for our level of earning capacity after we're treated by them. So now it doesn't matter if you have carpal tunnel, or if you have a respiratory issue, or if you have a heart problem, or if you have various kinds of cancers that are not catastrophic, or if you have uh, kidney or bladder problems, or well, let's see, where else can we go with this? Or if you have migraines, it doesn't matter because you're being treated. So what they're saying to us is the damage to our body doesn't matter because they're treating it. They're treating it by giving you meds or giving you a CPAP. Well, actually, CPAP, that's going away. If you use a CPAP, they don't care anymore. Oh, you're being treated. It doesn't matter that you're being basically chained to a device for the rest of your life. It doesn't matter that, when you step back and you look statistically, if you're chained to a CPAP, you lose anywhere from 10 to 20 years of your life. People who have severe sleep apnea and they're treated by a machine, statistically, they live less longer than people without them. That doesn't matter. It doesn't matter that if you're using a CPAP, you lose productivity daily because you're sleeping anywhere from 8 to 12 hours, which means you're basically sleeping from anywhere from 2 to 6 hours longer than most people. It doesn't matter. It doesn't matter. They've already backdoored the fact that if you're taking medication for blood pressure, you won't be compensated. The Republicans are doing nothing but screwing us over. And like I said 3 years ago, they're going to totally gut and screw up the VA because they hate the VA because it's a single payer health system just like Medicaid. And look what they're doing. They're gutting Medicaid. Project 2025, or what I think that's what it's called, Project 2025, is going to do nothing but screw veterans over because Republicans won't admit it, but they hate the VA. They try to pull on conservative heartstrings or, independent, resilient heartstrings by saying, hey, we're making the VA better so you don't get screwed over. So you and your doctor have more control. Yeah, but if you have less earning capacity because of service connected issues, they're going to take away your money. And all of this stuff about giving more control to you and your provider, not true. We found at the Saginaw VA, because of all their changes to their software, and some of this is particular to Saginaw, they still are working on two different systems. But that being said, they see less people. And in addition to that, our 7 day turnaround for the next appointment, actually, no, I'm correction, it was 3.5 day turnaround for your second appointment, which is the appointment after seeing, a referral. It's basically going to see them after seeing a referral physician or whatever, or a specialist, and then you're coming back for them to explain everything to you, which they're supposed to offer you a chance, not just put a message in the care notes. They're supposed to call you and say, yep, your results are in. Would you like an appointment to come in and discuss them? That's what they're supposed to do. But for some of us, they don't. But that it used to be that the Lieutenant Alita Lutz, um, that it was 3.5 days. And now, since the new software and everything, it's not. It could be several months. But could be, uh, because besides having using two different systems, and then that darn chart scribe or whatever, it's software that I was told they were going to stop using. It's where they put copies of imaging or outside specialist their reports, and they give you a summary in your blue note, your what do you call it, your blue button report. You just get a summary. They're supposed to put everything in there. It's Saginaw VA. I hate going there. It's I feel that the effort that's given to change and improve is tongue in cheek. Really, that's my honest feeling. Um, I don't get good care there. That's what's killing me. I hate going to that place. But for now, I'm stuck going there. And I'm just as unhappy to go there as many providers are to see me. And some of them will even tell me. Um, but anyway, it's Light Scribe or Chart Scribe or something like that. And I forget the name of the darn software. I always forget the name. But it's where they hide stuff because it doesn't go in your Blue Button report and VBA can't see it. It's a way to screw us over. I found my experience. I don't know what's going on at the Saginaw VA. Tons of conservatives, tons of QAnoners. I can't explain it. I've encountered some Hebrew Israelites there too, some anti-Semitic ones. Again, I don't want to judge an entire religion. I just see patterns. That's all. But Yeah, this was these couple of people I talked to are rather anti-Semitic, but as some of these new religious, uh, political ideology, religious ideology intertwined groups are. Um, but anyway, so I don't know what's going on here exactly, but yeah, this VA, they're like experts in finding a way to. Some people at this VA, I don't like generalizing people, which is why they should be investigated. Uh, a significant amount of people there, they're like experts in screwing veterans over. And older veterans or veterans that are under somebody else's managed care, sometimes by force, because I've heard veterans there, I've talked to them personally, where actually people at the VA have, twisted their arm behind their back to force them to get into a managed care situation. That forced them. Um, I've met several people that they were forced into that situation where they no longer have control of their care because the VA told them they had to do it. But so they know very little about what's going on. They feel they don't have any rights anymore. So whatever their medical guardian says is law, and many times these veterans are being screwed over. Because if there's one thing that you can make a lot of money at, that's taking over care of a veteran, putting them in a managed care situation, or putting them in a veterans nursing home or a veterans group home. They can make a lot of money in screwing us over, you know, which is what is really happening to me. I don't know if specifically there's a couple of people behind it or it's just the approach to care, but they're slowly crippling me and destroying my internal organs. And they either blame it on this ambiguous, barely investigated liver problem, um, and what's the other one that they blame stuff on? Oh, my diabetes, which we have no etiology of where it came from because I've never ate tons of sugar. I've never ate fat. We don't have diabetes in my family, not really. Maybe one or two people. We don't have a diabetic problem in our family. So, the question is, where the heck did it come from? Um, and they refuse to, properly address my tear exposures. Matter of fact, in some of them, they haven't even put in my record. Um, like I said, I don't like this VA. And can't forget how they canceled my comp claim and made it very difficult to appeal because I can't find a physician because everybody around here is Covenant. And Saginaw VA is very heavy with Covenant providers. Very heavy. Matter of fact, most of them at one time or still are Covenant providers, even the CNAs. Um, and St. Mary's is gone. My Michigan, yeah, some of the people that have been brought in, I don't really like the approach to care there. Um, yeah, several times. But that's what it is when you're being organized against. People will find every possible way to screw you over. Um, but anyway, what it does show though is be careful. Make sure you have your attorney on speed dial, because some of the providers at both of these places, they don't care about the law. They don't care about appropriate patient care. They don't care. They don't care about it. They'll do what they want. Um, so that being said, actually, I had one provider who's a medical student one time at Covenant actually tell me, when I questioned her about stuff, I questioned her about her approach to managing my care as an intern, and she refused to change it. I said, what about in light of this and this and this? She said, "Well, yeah, that may be true, but I'm not going to change. Not going to change my approach to manage your care. This is what I'm going to do: uh, prescribe you some pain medication, give you a crutch, send you out. It's not my responsibility to treat a knee problem. I'm supposed to treat the emergent issue relative to the knee problem, and that's it. Your primary care provider will deal with the long-term stuff." Um, so, which is a really crappy emergency physician. That's a really crappy attitude, and that's why I didn't like her. It's a really crappy attitude. But anyway, that being said, well, what that is, that kind of attitude, once she goes in and she's no longer in an internship, eventually an organization, she's going to cost them money because that's the kind of care approach that when it matures, it will let people get hurt. It may even hurt people on purpose, and that's going to cost the organization money. Bad doctors, bad nurses, bad attitudes fruit into bad providers, and they cost organizations money. Now, some organization may have the idiotic and really obtuse attitude of, well, providers are going to be sued, which is stupid because that's not necessarily true. If you train right and you pick the right people, you may never be sued. But anyway, I hate dealing with pessimistic, obtuse people, which brings us back to the VA. Now, this kind of obtuse approach to care, um, you know, to bring up the earning capacity issue, which they love to bring up. This is conservatives talking. They're worried about more earning capacity than they are actual medical care. Um, Earning capacity is tied to your medical care and your outcome, but they're not focused on outcomes. They're focused on earning capacity, which means conservatives in control. Um, I used to be a conservative. I don't like them anymore. I'm a moderate. I listen to the Holy Spirit give me guidance, and I look at the facts and whatever evidence is present regarding whatever an issue, somebody's care, a medical problem, whatever, an investigation, whatever. Um, I see the conservative approach is destructive, and I'd rather be in the room with a liberal nut than I would be with a conservative that has a piece of coal up their butt that if they let it go out, it would become a diamond. I'm sick of the destruction that's caused by people so conservative. Instead of looking at facts as they fall, listening to the guidance of the Holy Spirit, of the light, and then deciding about a particular stance on something or the direction that I should take about something. Um, yeah, I've just seen, this administration and why my support is dwindling. They're gutting everything. And when they walk out of office, first of all, God forbid we elect another Republican in 2028. God forbid. Um, but that being said, they're gutting our country. And yeah, I expect the next president, I hope that they're libertarian or a Democrat. Um, and they're going to have to do a lot of repairs. And at first I was scared of posting stuff that's skeptical or critical of the current administration, but I just see the stuff they're doing to veterans, and I can't be quiet. They're just destroying our lives. Here we are already with significant medical issues, and they're trying to roll back the PACT Act. They're trying to roll back our pensions saying, "Oh, here we throw a little bit of bones, medication or some medical device, so you should be able to be like everybody else now." Um, not only is it unpatriotic, but it is disingenuous. And personally, I despise, no, I hate disingenuous people. I hate them. You know, to say it like on the streets, if you ain't real, I'm not going to be real with you. I don't even want to be around you. And you can make up whatever fake identity you want or try to protect yourself with the long arm of the government. But again, all it does is make me despise your attitude and your personality. I have to love you as Christ would. I'm not saying that I'm a good Christian, but I have to love you as Christ would. But your attitude, your personality, your behavior is wicked. And even for those who go to Christian, go to a Christian or a Jewish or rare but Muslim, conservatives who go to their place of worship, in my opinion, you walk out as frauds, just like you walk in as frauds. People who have no empathy and they're gutting our country, there's no God within them except themselves. Their own conservative ideology has become their God. They're no better than the hypocrites that Jesus criticized. That's the way I look at it. The worst God is the God within. And, so again, we return back to the VA. They, Republicans in Congress and the current VA administration, they're doing the same thing that they were trying to do 3 months ago to gut our financial benefits and give us the meager medical care we have now, and saying that it's returning us to full capacity when it's not, and saying we need to get up. Um, what's the word? We need to get in tune with everybody else, um, based on the meager care we get, medication, medical devices, and not rely so much on that pension because they plan to try to take it away.